Most people over 65 who used to smoke are told the same thing. You quit. The rest takes care of itself. It sounds sensible. It sounds safe. But here is what nobody tells you. Quitting does not erase the risk you already built, and it does not protect your independence on its own. Here is the part that should have been said out loud years ago. There is a scan covered for people who qualify that finds lung cancer while it is still small enough to remove. Large national trials have shown it lowers the chance of dying from lung cancer. And yet national screening reports keep finding the same thing, that fewer than 1 in 5 eligible adults has ever had it. In the next few minutes, I will give you 5 things about this scan that most appointments never cover. I will also give you the one insight that decides whether you are ever offered it at all. The number 1 item on this list is something almost nobody talks about. Stay with me until the end, because that one can change how you approach the next 10 years. Think about how a normal appointment actually goes. You get about 12 minutes. In that time, your doctor reviews your blood pressure, your medication list, your sleep, your knees, and your last set of labs. Lung cancer screening is not a blood test that appears on a panel by itself. It requires someone to stop, ask how many years you smoked, ask how many packs a day, do the arithmetic, and then open a separate conversation. That conversation takes 10 minutes of its own, and the visit does not have 10 spare minutes. So it quietly falls off the list, year after year, for millions of people who qualify. I am not here to sell you a supplement or scare you into a course. This channel exists to give you the science a 12-minute appointment never has time to cover. There is nothing to buy in this video. There is only a number to calculate and a sentence to say out loud. Here is why this matters for your independence. Lung cancer found early is often handled with one operation or a short course of focused radiation, and most people go home and carry on with their lives. Lung cancer found late means months of treatment, oxygen, weakness, and needing help with the ordinary things you do now without thinking. So before we go further, do something for me. Type your age in the comments and the year you stopped smoking. Please do not skip this section. It is the key to everything that follows. Here is the one mechanism behind everything in this video. Deep lung tissue has almost no pain nerves of its own. A tumor can grow there for years and send you no signal at all. You feel something only when it reaches an airway, presses on the chest wall, or travels elsewhere, and by then the small window has usually closed. Think of the plumbing inside the wall of your house. A pipe starts to weep behind the plaster, nothing drips on your floor, nothing sounds wrong, and you go on with your week. You find out months later when the ceiling stains and the beam is already rotten. This scan is the inspection camera that looks inside the wall while it is still one small drip. Your lungs did not come with a warning light. That is not bad luck. That is anatomy. If this is already making sense to you, tap the like button so more seniors can find it. It costs you nothing, and it puts this in front of somebody who needs it. Number 5 is your pack year number. Not a rough sense of how much you smoked, but one specific figure written on paper. Pack years are the currency every screening guideline is written in. 1 pack year means 1 pack a day for 1 year. 2 packs a day for 10 years is 20 pack years. Half a pack a day for 40 years is also 20. Think of it like mileage on a car, where nobody asks how fast you drove, only how many miles are on the engine. The United States Preventive Services Task Force sets its screening threshold at 20 pack years. Medicare wrote that same number into its coverage rules, so here is tonight's arithmetic. Write down the average number of packs you smoked per day. Then write the number of years you smoked at roughly that rate. Multiply the two. If the habit changed over the decades, do it in blocks, 1 line per decade, then add the lines. The mistake people make is rounding themselves down out of embarrassment, and that one habit keeps qualified people out of screening. If the years blur together, use anchors, the house you lived in, the job you had, the year the children left. If you cannot pin it down, write your best honest estimate and bring the paper anyway. And here is the stop condition for this entire video. If you are coughing blood, losing weight without trying, or staying hoarse for weeks, stop calculating and call your doctor this week, because that is not screening anymore. Pair that piece of paper with your medication list. Bring both to the same visit so the whole picture sits in front of your doctor at once. 1 page, 2 numbers, 30 seconds of your appointment. But the pack year number opens only half the door. There is a second number on the form, and it is a clock that has been running since the day you quit. Get that one wrong, and a qualified person is told no. Stay with me, because item number 1 is what turns both numbers into an actual appointment. Number 4 is the 15-year quit clock. It is the second figure that decides your eligibility, and almost nobody knows it exists. Coverage rules ask how many years it has been since you stopped smoking. Under Medicare's current rules, the answer must be 15 years or fewer. Risk does fall after you quit, but it falls slowly, and it never returns to the level of someone who never smoked. Picture a fire that has been put out in a wooden house. The flames are gone, the beams are scorched, and the inspector still wants to look at them. Here is where it matters. In 2021, the Preventive Services Task Force kept the 15-year limit. In 2023, the American Cancer Society dropped it, and now recommends screening after 20 pack years no matter how long ago you quit. So this is the protocol. Write the year of your last cigarette directly under your pack year number. Subtract that year from this one. If the answer is 15 or less, you are inside the coverage window, and you should be asking this month. If it is more than 15, do not walk away. Say this exact sentence. I know I am past the 15-year mark, and I would like to talk about the American Cancer Society guideline. The safe way to handle a no is not to argue in the room. Ask instead that the conversation and the reason be written into your visit notes. If you feel yourself getting worked up, stop and ask for a separate appointment about this alone. A calm second visit gets further than a tense first one. Pair this with your age. Coverage generally starts at 50 and runs to 77 under Medicare rules, while other guidelines run to 80. If you are in your late 70s, ask which age ceiling your plan uses. Now, 2 numbers on paper get you to the door, but something is working against your lungs right now tonight in the room you are sitting in, and it has nothing to do with cigarettes. Number 3 is a radon test in your own home. It is a colorless gas that seeps out of the soil, and it is the second leading cause of lung cancer. Radon comes from uranium breaking down in rock under your foundation. It enters through cracks, sump openings, and floor drains, then collects in the lowest lived-in level of the house. Breathing it damages the lining of your airways in the same neighborhood where old smoke damage already sits. Think of it as exhaust, leaking slowly into a closed garage. You cannot smell it, you cannot taste it, and the house looks perfectly normal the whole time. The Environmental Protection Agency estimates radon causes thousands of lung cancer deaths in this country every year. It sets 4 picocuries per liter as the level at which you should act, and that number will be printed on your result. Here is the protocol. Order a short-term radon test kit, usually $15 to $30, or ask your state health department because many give them out free. Place it in the lowest level you actually spend time in, 2 to 3 feet above the floor, away from windows and drafts. Keep outside doors and windows closed for 12 hours before you start and throughout the test. Leave it in place at least 48 hours, then mail it the same day you finish. If the result is 4 or higher, call a certified radon mitigation contractor, because a vent system usually runs $800 to $2,500 and drops the level within days. Here is the safe setup. Do not climb into a crawl space or onto a step stool to place the kit. Set it on a shelf or table you can reach flat-footed, or ask a neighbor to place it. If you feel dizzy or short of breath moving around the basement, stop, sit down, and hand the job to someone else. Pair the radon test with the smoke detector check you already do. Radon and old smoke exposure multiply each other's risk rather than simply adding it. Same weekend, same clipboard, 2 things off your list, so you have your numbers and you have your house. What you do not have yet is control over what happens after the scan, because one word frightens more people out of screening than anything else. Number 2 is understanding the word nodule before anyone says it to you. It is the most common reason people regret being screened, and it should not be. A nodule is a small spot on the lung, and most of them are nothing. They are old scars from infections you had decades ago, sitting quietly ever since. Radiologists sort them with a scoring system called LungRads, from 1 to 4. Think of it like a home inspection report. Most lines say monitor, a few say check again in 6 months, and only a small number say act now. In the original national screening trial, the great majority of positive scans turned out not to be cancer. The scoring system came afterward, and it cut those false alarms sharply. So here is the protocol for the day your result arrives. Ask for the LungRADS number 1 through 4 before anything else. If it is 1 or 2, your next step is one more scan in 12 months and nothing else. If it is 3, the standard step is a repeat scan in 6 months, not surgery. If it is 4, you will be sent for more imaging or a sample, and a specialist takes over. Write the number and the interval on the same paper you carry, so the plan lives somewhere other than your memory. Here is the stop condition for worry. Do not search the internet for nodule sizes at 11 at night. If you are losing sleep, call the office and ask one question. What is my LungRADS number, and when is my next scan? Pair this with the bonus the scan gives you free. The same pictures show calcium in your heart arteries and early emphysema. Ask directly whether your report mentions coronary calcium, because that finding can change your heart care. Now you know the numbers, the house, and the vocabulary. Everything so far has been preparation. Item number 1 is the thing itself, and it is the part almost nobody is ever offered. Number 1 is the low-dose computed tomography scan of the chest, and the shared decision-making visit that unlocks it. That second phrase is the password, and it is why so many people never get past the front desk. A regular chest X-ray takes one flat picture, and a spot the size of a pea hides behind a rib, or the shadow of the heart. A low-dose CT takes a series of thin slices through the chest and rebuilds them into a three-dimensional picture. Think of an X-ray as a photograph of a loaf of bread from the outside. The CT slices the loaf and lays every slice on the counter. A single seed in the middle is invisible in the photograph and obvious on the counter. That is why chest X-rays were tested for screening, failed, and were replaced. The dose is kept deliberately low, usually around 1 to 2 millisieverts. That is a fraction of a standard chest CT, and roughly what you absorb from the world around you over several months. The National Lung Screening Trial, run by the National Cancer Institute, compared this scan with chest X-ray in people at high risk. It found about a 20% reduction in deaths from lung cancer in the group that received the CT. A large European trial called Nelson reported a similar benefit a decade later. Here is exactly how to get it. Call your doctor's office and use these words. I would like to schedule a lung cancer screening shared decision-making visit for low-dose CT. At that visit, hand over the paper with your PAC year number and your quit year. Ask 3 questions. Do I meet the criteria? Is this facility accredited for lung screening? And what will I owe? For people who meet Medicare's criteria, the counseling visit and the annual scan are covered as preventive services with no copay at most accredited centers. The scan itself takes about 10 minutes. There is no needle and no dye, and you hold your breath for roughly 10 seconds. Then comes the part that decides whether any of this works. This scan is annual, not once. One scan is a snapshot and screening is a movie, so book next year's before you leave the building. If you have trouble lying flat or holding your breath, say so when you book, because the technologist can coach you through it. If getting there is the problem, ask about hospital transport or a screening site closer to home, and bring someone with you the first time. Now the stop condition, and it is the most important line in this video. Screening is only for people who feel well. Coughing blood, unexplained weight loss, a cough that changed and stayed changed, or repeated chest infections mean a diagnostic appointment this week, not a screening appointment next month. Early is not luck. Early is not genetics. Early is scheduled. Pair the scan with 2 things on the same day. Ask that your smoking history be entered into your chart properly so the reminder fires by itself next year. Ask whether your report will mention coronary calcium, so one appointment protects 2 organs, 1 drive, 2 systems. I told you at the start that item number 1 was something almost nobody talks about. Here it is. Not the scanner, which sits in every large hospital in the country, but the sentence that opens the door to it. Say shared decision-making visit for low-dose CT out loud, and you move from the 4 and 5 who were never offered this to the few who were. Consider a typical case documented in the lung screening literature. A 72-year-old woman had smoked about a pack a day for 22 years and stopped 11 years ago. She felt fine, walked her dog every morning, and had never once been asked about her smoking history at a routine visit. Her daughter did the arithmetic with her at the kitchen table. 22 pack years, 11 years since quitting. She called and asked for the shared decision-making visit by name. Her doctor confirmed she met the criteria, and she had the scan 2 weeks later. The report came back with a small nodule and a lung RAD score of 4. That meant more imaging, not surgery, and she had a second scan and then a sample. It was an early-stage lung cancer, still confined to one lobe. She had one operation, stayed 2 nights, and was walking the dog again within a month. There was no chemotherapy and no oxygen tank. Cases like hers are why the trial numbers look the way they do. Found early, most people go home. Found late, most do not. Let me leave you with a short list you can actually finish. Every step has a number in it, so there is nothing to interpret. Tonight, step 1. Write 2 figures on one piece of paper. Your packs per day multiplied by your years smoked and the year you quit. Step 2. Tonight. Subtract your quit year from this year and circle the answer if it is 15 or less. If it is more than 15, write the American Cancer Society sentence on the same paper. Step 3. This week. Call your doctor's office and say one sentence. I would like a lung cancer screening shared decision-making visit for low-dose CT. Step 4. This week. Order one radon test kit, place it in the lowest level you live in, and leave it there at least 48 hours with the windows closed. Write the start date on the envelope so you know the day it goes back in the mail. Step 5. This month. On the day you finish your scan, put next year's scan on the calendar in ink, because 12 months is the interval that makes screening work. Think of someone in your life who smoked years ago and believes that chapter is closed. A son or a daughter watching this can make one phone call and start the whole thing moving. Send them these few minutes, because the arithmetic takes less time than the worry does. Tell me in the comments which of these you are starting tonight. Your answers decide exactly what I cover next. And if you want the science a 12-minute appointment never has time to cover, subscribe to this channel. That is the whole mission here, nothing more. This video is education, not a diagnosis. Your own doctor knows your history, so bring this list to your next appointment. I'm Kenji Vance. Don't forget to subscribe and live longer.